Kwan, Michael Lindsley, Gail Neowith,
Present.
Judith Salerno, Sydney Hankerson. Very good. I'll start the proceedings with just a few brief remarks. Obviously, last week I announced my impending intention to step down at the end of the year, perhaps early January. It's a decision that was taken with a lot of deliberation, not a small amount of sadness, of course. It's very bittersweet, but certainly was the right timing and right for my family, my young family. I have 3 small children, all below the age of 11, who need me home for a while. And so I'm looking forward to rededicating to them after what will be 3 years of service in this role. So I know that was met with a lot of surprise, but I just want to say how proud I am to have been in this role, how privileged I feel. The privilege of having this role is an awesome one. You get to have both very real and direct impact on this wonderful city, the city I love, the city where I have called home for 15 years and where I've started a family, but also have a platform where you can represent that work across this city, across this country, and well beyond. It's a very unique job with a unique set of pressures, which have certainly changed in the COVID era and the post-COVID era, but a job nonetheless that is one that gives me a great deal of pride to have held for even this for this short amount of time, this 3-year period. I want to say also that I'm very proud of our team, very proud of our senior leadership in particular, but our entire team, 7,000 staff here at the health department who come every day focused on making a difference in people's lives, and that remains the focus today, yesterday, today, and tomorrow. Whatever is going on around us, it is the mission, the work, the effort that we make every single day to improve health, prevent suffering, save lives. That is the most important work that we can do, and that work remains undeterred. I also lastly say that the department and our work is in a very strong place, and I'm very confident about where we are headed, and also what I'm handing off to my eventual successor. Whether it is work to define a North Star for the city in the form of Healthy NYC, our work on reproductive rights and abortion access, which you'll hear a little bit about today, and you've been hearing at previous board meetings quite a bit since the Dobbs decision in 2022, our work on healthcare transparency, affordability, and accountability, our work on mental health, which has been really path-breaking in partnership with so many other city agencies. The focus on mental health and really an upstream approach has been one that I'm extremely proud of. And that is to say nothing of the internal investments we've made here at the department on things like data modernization and the launch of our new Center for Population Health Data Science, on workforce and the investment we've made into workforce wellness in particular, and improving work conditions for public health workers, a group of workers that have certainly experienced quite a bit over the last 4 to 5 years, or work on our response readiness. So preparing us for the eventuality of a next health emergency or a next pandemic by setting ourselves up administratively, operationally, fiscally, and from a human resources perspective and strategy perspective to respond quickly and to respond effectively is key to building up stronger public health departments. And this city and this country needs a strong public health department, and it has one. And so I'm very, very proud of the work that we've all done together over the last 3 years to make it so, or to make it once again so. So I'll leave with that. We will have one more Board of Health meeting. It's likely before the end of the year, so maybe another chance to kind of look back. But I just want to end by saying thank you to all of the Board of Health members for your service. Thank you for your partnership. Thank you for your support of this department and its agenda to advance public health. We can't do it without you. This board is older than the department itself. The department's about 200 years old. The Board of Health is older than that. So you're part of a long and storied tradition of protecting the vulnerable, improving health, and saving lives. And so you should feel very proud of that. I'm very proud to know you all and to have worked with you all, and thank you. So with that, we'll get on to the business of the day. I will hand the mic over to Dr. Celia Quinn, our Deputy Commissioner for the Division of Disease Control, to give an update on communicable diseases.
Thank you. Okay. Good afternoon, everyone. I'm delighted to be here to talk a little bit about what's been in the news recently in the world of infectious diseases. The Division of Disease Control here at the Health Department safeguards the health of New Yorkers through the identification, surveillance, treatment, control, and prevention of infectious diseases. And the city's public health laboratories and also our public health clinics covering TB and also sexual health clinics and our immunization clinic also falls under our purview. Today I'm going to give some recent updates on infectious disease topics that we have been focusing on most recently, as well as some that you might be hearing about in the news. It definitely does not represent the totality of work in our division, but rather just some highlights that we thought might be of interest to the Board of Health and others. So I'll go to the next slide, and first I'll be talking about measles. We can move to the next slide. This topic has really been at top of mind for everyone in the public health community in recent years, as we've seen an increase in outbreaks happening globally, and that also includes within the U.S. It, of course, makes it especially important for people to be vaccinated against this very transmissible and serious disease. And so I want to remind New Yorkers that the measles, mumps, rubella, or MMR vaccine is safe and effective, and also a timely reminder that it's required to attend school in New York City. As of August of this year, New York City has had 13 confirmed measles cases during the calendar year of 2024, and that compares to just one case in all of 2023, which actually happened right at the end of 2023. And you may have heard that in July of this year, the health department responded to 2 measles cases in a shelter and successfully coordinated the shelter residents' quarantine and isolation and vaccination for people who are exposed or at risk, as was needed. And ultimately, no secondary cases were identified related to those 2 cases in the shelter. So although we had a successful response to that, we're still vigilant because nationally, as of just last week, 262 measles cases have been reported in the U.S. by 32 jurisdictions. That's in this year, 2024, there were only 53 cases in all of 2023. And a lot of these cases are associated with international travel, so that is part of the explanation for the increase between the 21-22 era and 2023. Next slide, please. So it's always a good time to talk about COVID-19. Here in New York City, cases of COVID-19 that are reported to us have been declining since we had a summer wave that peaked around late July. And now we have updated COVID-19 vaccines for this 2024 to 2025 season. They should now be widely available. They are recommended for everyone 6 months and older. And New Yorkers can use our vaccinefinder.nyc.gov website to find locations that they can receive the COVID-19 and also flu vaccines are posted there. Our efforts this fall are focused on vaccine messaging for the fall respiratory virus season generally and supporting access to vaccination for uninsured New Yorkers. Next, please. I also want to talk about sexually transmitted infections. These continue to occur at an unacceptably high rate across New York City. Sharing some data from 2022, where we saw increases in several diseases since 2021. So chlamydia increased 5% among men and 1% among women. The gonorrhea rate increased 11% among men and decreased 15% among women. We've also seen increases in primary and secondary syphilis. Those increases have driven a rise in congenital syphilis cases in New York City and nationally, which is extremely concerning. In 2022, there were 19 cases of congenital syphilis in New York City. And although that was a slight decrease from 2021, the trend is consistently higher since 2018. We've been doing a lot of work in this area, especially with our public health clinics. And one of the innovations I wanted to share is about our promotion of doxycycline post-exposure prophylaxis. We are promoting this citywide among providers who take care of people that might be at risk for sexually transmitted infections, but we are also offering this at a couple of our sexual health clinics, in addition to the ongoing work we do recommending prevention, screening, and treatment practices. Next slide. So tuberculosis is an area where we had seen progress citywide and nationally in recent years. And by 2019, we had reduced the rate of TB in New York City to 6.9 per 100,000 New Yorkers. But those trends were interrupted by the COVID-19 pandemic, and progress began to reverse after the pandemic. So in 2023, the city had the rate of active TB cases in New York City had increased to 7.8 per 100,000, and there were a total of 684 active TB cases reported in that year. That's a 28% increase from the previous year, and the highest number of active TB cases reported in New York City since 2011. In New York City, we did see those increase among various different populations, including individuals who are newly arrived from countries that have higher rates of TB, but also young children, people with a history of homelessness, and other vulnerable groups. So with this slow-moving disease, we especially recognize how critical it is to get a handle on what is happening with transmission of TB now before things escalate further. So we have been working really diligently on our TB program to make sure that we're able to respond to this increase in tuberculosis. Next slide. I'm going to cover a few different emerging issues. So first, I want to talk a bit about mosquito-borne diseases. So in New York City, we have a very robust program for surveillance for mosquito-borne diseases. We do routine trapping and testing of mosquitoes across New York City, and in 2024, detected more than 1,500 pools of mosquitoes that were positive for West Nile virus, which is endemic here. But that was a very high number of positive mosquito pools for West Nile virus, exceeding the number that we saw in the previous year. And along with that, we also documented 19 cases of West Nile neuroinvasive disease and 5 cases of West Nile fever in New York City in 2024. And that's to date. So we had 31 cases also in 2023. You may have also heard in the news recently about Eastern equine encephalitis, which is also known as triple E. There was a case in a New York State residence that led to the person's death, and that was in Ulster County. So the mosquitoes that are infected with triple E are typically not found in New York City. It is something we do surveillance for. The conditions in New York City are not ideal for that virus. But we did detect a sample for mosquitoes in Suffolk County that was positive. So it is something we continue to monitor really closely. Triple E is a very serious illness, and only a few cases are reported annually in the U.S., but in general, concern for mosquito-borne disease is increasing, definitely in the East Coast. Next slide. A couple other mosquito-borne diseases also in the news. So dengue and then also Oropouche virus are primarily travel-associated illnesses in New York City. There are multiple large dengue outbreaks occurring globally, mostly impacting the Caribbean and Central and South America. And there is a small number of locally acquired cases in the U.S. These have occurred in Florida, California, and Texas. Here in New York City in 2024, so far, we've had 159 New York City residents diagnosed with dengue fever, and as of September 17th, and then that is compared to 169 diagnosed in all of 2023 and only 59 in 2022, following a similar pattern that we've seen with other travel-associated illnesses. And then cases of Oropouche virus have also been increasing in South America and the Caribbean. This is another emerging infection that had previous very limited transmission in the U.S., but it is being monitored closely for importation, especially because of the risk of potential for locally acquired diseases in places that have the same mosquito vectors. Next slide. Okay, we've also been really monitoring closely the situation with Mpox Clade 1. So in August, the World Health Organization declared the Mpox Clade 1 outbreak that's currently happening in the Democratic Republic of Congo a public health emergency of international concern. So compared to Clade 2, which is a strain of Mpox which drove the 2022 global outbreak that really seriously impacted New York City, this other strain, Clade 1, appears to be more infectious and can cause more serious disease. To date, though, no cases of Mpox Clade 1 have been identified in the U.S. Here at the health department, we do mpox testing, both for specimens from our own sexual health clinic or as a reference lab. We monitor citywide laboratory reports for potential clade 1 mpox reports, and we're also prepared to coordinate with CDC for confirmatory testing if that is indicated. Meanwhile, in terms of prevention, the 2-dose JDOS vaccine is recommended for people with risk factors who are traveling to the impacted region and for people who are at risk for more severe disease, such as people who have advanced HIV. We are sharing locations where New Yorkers can find the mpox vaccine JDOS at our vaccinefinder.nyc.gov. And our sexual health clinics are offering this vaccine as a standalone service on a walk-in basis, regardless of insurance or immigration status, so people are able to access this vaccine there as well. Next slide. The other thing I want to talk about is H5N1. So this is highly pathogenic avian influenza, H5N1. It's a strain of influenza that affects birds and has been found in poultry and wild birds in many areas, including New York City, for a couple of years. This year, it began being detected in dairy cattle and other mammals in other parts of the U.S., and that has caused a lot of concern among the public health community. This strain of the virus has not been detected in any dairy cattle in New York State, and there are no dairy cattle herds in New York City, so this is largely a problem that's impacting our colleagues in other states and localities, but we're monitoring it really closely. We do monitor and test any people that we know are exposed to an infected bird or animal when needed, and recently CDC had been investigating a case of H5 in Missouri. It was in a person who didn't have any known exposures to sick or infected animals, and so more investigation was really needed to try to understand what happened with that particular case in Missouri. Meanwhile, CDC and the New York City Health Department monitor flu surveillance for any unusual trends, and we have not seen anything like that to indicate that there's unusual flu activity in people, including any evidence of avian influenza impacting people, certainly in New York City. So that was a little bit of a potpourri of various infectious disease issues. Again, certainly not comprehensive of what our division is working on, but just some of the things that I've been getting a lot of questions about and wanted to share with you as well.
The pathogenicity of the HPA1 is manifest how in these animals, because we haven't seen it in people, you say, right?
Right, yes, that's an important question, thank you. So when we talk about highly pathogenic avian influenza or low pathogenic avian influenza, it's referring to the pathogenicity in birds. For this one, highly pathogenic avian influenza in birds is a pretty serious disease, so when it enters bird flocks, it has to be really rapidly culled or else it can spread and really cause death of a lot of the poultry on the farms. Interestingly, in cattle, this HPAI is not causing serious disease in cattle, so that is another important difference. And all of the small handful of cases of H5N1 in humans have been very mild disease. Right.
Thank you for your presentation. Could you tell me a little bit more about dengue and how it's manifesting, the severity of the cases? Because you can have a whole range from asymptomatic through critically ill dengue.
Yeah, so dengue is reportable in New York City, so all cases are reported to us both electronically and then by providers calling us to find out how to do the testing, et cetera. So we do see a range of different kinds of presentations. For dengue, our main interest in doing surveillance for dengue is to make sure that we're still continuing to see cases that are associated with travel. We have not seen any cases that are locally acquired, so we're really investigating to figure out, make sure this person traveled to a dengue endemic area, and that's likely where they were infected.
I want to thank you for how closely you worked with health and hospitals around the measles outbreak. I thought that was a great example of our departments working closely with an excellent outcome. And I really appreciate all that you did. Same around TB, where we treat a very large number of cases and appreciate working with you. It's been really terrific. My two more general comments are not things that any of us can easily deal with. I think on the doxy, the recommendation, I wouldn't say is well disseminated. I think it's a hard message because so many of us have been concerned about antibiotic resistance, right? And the great thing about PrEP is the regular antiviral PrEP is that it doesn't cause worry about resistant organisms. And the concern that many practicing physicians have about doxy and whether it would or wouldn't lead to resistant organisms has made people wary. And my other general notice is that it's distressing to me how little interest there is in the COVID booster. I mean, I don't, I think, in my, own practice, almost none of my patients, despite a fairly enthusiastic, endorsement, are interested in getting it. I don't know it's such a complicated emotionally COVID for so many people. And the vaccine has the problem that people who get vaccinated will sometimes get COVID, right? And so because of that, it's a very hard sell, which I think is unfortunate as we go into another, round. I don't know what sort of the best, I mean, it's a national issue, right? We probably do better than many places. But it's, at least in my practice, it's dismal, the willingness to take a booster.
Yeah, thanks, Dr. Cass. Strongly agree, and also the tremendous work together with your teams over the summer, many late night, weekend, early morning, all the time calls about that, and it was a really good experience working with them. The doxycodone, I specifically didn't talk about antimicrobial resistance today because I'm hoping to come with some stuff about antimicrobial resistance at a future Board of Health meeting. But yeah, we're doing a lot of work both with providers and also trying to understand community interest in DoxyPEP and what some of the issues are. So I actually think I have a upcoming call with some of your stuff about that in a little while. But yeah, certainly a more challenging topic than some of the other things. And then on the COVID boosters, yes, I think it's also, we're still trying to figure out what is the optimal timing for the COVID boosters, what is the duration of protection that people have, and these are all things that make our job more challenging in terms of encouraging people to get the COVID vaccine. I will say, it took us many, many years, and we were slowly able to get flu coverage up pretty high in our most vulnerable older populations, and I think we can take lessons from that and try to grow it slowly, and especially focus on those populations that are most at risk.
Yeah, I think that's absolutely right, and you've been a huge teacher to me on that history of how we got flu rates. I mean, our flu coverage in the 65 and 75-year-old population in the city is upwards of 70%, I think, which is pretty good, which is kind of where we need to be for the COVID shot too. The messaging, I think, and I know that ACIP and CDC are kind of wrestling with this, saying everyone should get it, but then really targeting your resources and your outreach to the patients who need it the most, I think is always a challenge. I'm seeing the same thing you're seeing, and I'm seeing it even to the point where, training doctors are forgetting to offer it because they're getting so much resistance, they're just not offering it. They're not having that kind of counseling and discussion with their patients, and I'm reminding them in my teaching sessions to do it. So it's yes, this vaccine has been stigmatized, and we need to destigmatize it as much as we can. Any other questions for Dr. Quinn before I let her go? Thank you for the excellent update, and thank you for everything. Okay, so let's get on to the business for this meeting today. We'll start with the approval of the minutes from the June 2024 meeting. Are there any corrections to the minutes? Okay, so if there are no corrections, can I have a motion to approve the minutes as distributed? Can I have a second? Second. All those in favor? Any dissent? Okay, the motion carries and the minutes from the June 24th meeting are approved. The first item on our agenda is the notice of adoption to amend Articles 203 and 205 of the New York City Health Code. And our presenter is Dr. Gretchen Van Wy, our Chief Epidemiologist and Deputy Director of the Center for Population Health Data Science. Over to you, Dr. Van Wy.
Hi, thank you very much. So today we are here with you to go to the next slide, to seek board approval for the two termination of pregnancy items that we flagged or brought to you in June. First, to adopt amendments to Health Code Articles 203 and 205. Second, the other element, sorry about that. So the other piece we are here today about is a form change, just a little bit of housekeeping related to the spontaneous termination of pregnancy form. So at the June Board of Health meeting, we introduced a notice of intention about Health Code Articles 203 and 205. These proposed changes would allow a designee of a licensed healthcare provider to report a termination of pregnancy through changes to Article 203, to different parts of Article 203. We also propose to make disposition of a product of conceptus optional rather than required through changes to Health Code sections 203 and 205. And then we also propose to update make gender neutral language through the Health Code. So rather than say woman, to say a pregnant person. And the board approved these proposed amendments for publication and comment. Next slide, please. So since the June Board of Health meeting, the notice of intention was published in the New York City Record on July 2nd. The public hearing was held on August 15th. No one testified. We did, though, receive comments in written form. We received 36 written comments from 57 different entities. All the comments responded to the proposal to make disposition of a product of conceptus optional rather than mandatory. 19 opposed this amendment on philosophical or religious grounds. 37 supported in 16 written comments, so one letter had 22 signatories, and many of those signatories were medical practices or institutions, citing reproductive health choice and non-governmental intervention in family-private affairs, and one comment was neutral. Comments regarding the gender-neutral language amendment had 2 in favor and 2 opposed. So the department reviewed these comments and has provided them to the board for consideration. And today, after consideration of the comments received, the department asks the board to adopt the amendments to the Health Code Articles 203 and 205 as they were initially proposed. Next slide, please.
Do we have any questions or comments? Okay, so then we can proceed to a vote. We will vote on the proposed health code amendment to adopt Articles 203 and 205 of the New York City Health Code. Can I get a motion to approve? Second. All those in favor? Any dissent? Okay, with the unanimous vote, the motion carries. On to our next agenda item, which is proposed changes to Vital Statistics Form VR 17.
So as I mentioned, this is a little bit of housekeeping, but in June, the board approved changes to the termination of pregnancy forms to ease the burden of reporting by broadening the scope of certifiers. This makes it much easier for providers. To fully complete that process, we just are asking that the board approves listing additional providers on that form to make it consistent with the other form that we proposed. So this was just an oversight. So what we asked to have listed there is physician assistant, nurse practitioner, licensed midwife, and this other specified category. So this is what was approved in June. You can see the highlighted area is the area where we added the facility administrator. We didn't add the additional types of providers though, and that's what we're asking to add today. Next slide. And you can see that with the proposed change, we would have these additional providers listed on the form.
Any questions or comments about this housekeeping form change? Okay, can I have a motion to approve the proposed vital statistics form changes VR 17? Second? All those in favor? Any dissent? The motion carries unanimously. Thank you. Okay. So I want to thank Gretchen, Dr. Van Wy, for her, not just for her work today, but as you've seen over the last 2 years, a consistent leadership of trying to protect people trying to access reproductive health care and abortion through data privacy and through amending our data collection practices here in the city. So thank you, Dr. Van Wy. Our next item on the agenda is notice of adoption to amend Article 89 of the New York City Health Code regarding mobile food vending. Our presenter is Jeffrey Hunter, Assistant Commissioner of the Bureau of Environmental Health Administration. Over to you.
Commissioner. So my presentation here will be brief. In the June Board of Health meeting, we proposed to amend the health code to mirror local law 52, which eases some administrative burden for mobile food vendors. Next slide. To recap, local law 52 loosens permit application requirements for tax clearance certificates. The certificate of authority to collect sales tax is also no longer required for mobile food vending license holders. Those are the workers on the cart. However, this requirement remains for the permit, so the actual business in the mobile food vending unit. Next slide. After the NOI was approved in the June Board of Health meeting, the NOI was published in the City Record July 30th. Public hearing was held in September, and no related comments were received. No changes were made to the NOI. Next slide. So today, we're asking the board to adopt the proposed amendment. I'll turn it over to the board.
Any questions at this time about the proposal? Okay, can I have a motion to approve notice of adoption to amend Article 89 of the New York City Health Code regarding mobile food vending? Good, second. All those in favor? Any dissent? The motion carries unanimously. Thank you, Mr. Hunter. Our final item on the agenda today is the proposed resolution to amend Article 131 of the New York City Health Code regarding buildings generally. Our presenter is Jean-Baptiste Rudat-Sikira, Executive Director of Environmental Health Legal Services within Environmental Surveillance and Policy. Over to you.
Thank you, Commissioner. Good afternoon, everyone. I'd like to present to you the Board of Health proposing to Article 131 of the New York City Health Code. First, we're proposing to amend 13107 to comply with local law regarding minimum temperature in a dwelling between October and May. As you know, a local law is passed by the City Council and sent to the Mayor. Local laws are published in the New York City Administrative Code. Second, we're proposing to align the modification language in Section 131.19 to other modification provisions in the Health Code by eliminating the appeal process. Article 131 is the only part of the Health Code that provides appeal language in its modification provision. Such an appeal language is not required by law and is inefficient in terms of the use of agency resources. Next slide. So, what changes did local law 86 make? Between October 1st and May 31st, dwellings are required to maintain minimum temperature of 62 degrees Fahrenheit instead of 55 degrees Fahrenheit between 10 p.m. and 6 a.m. The overnight temperature minimum must be maintained regardless of temperature outside. Prior to local law 86, the minimum temperature had to be maintained overnight only if the temperature outside fell below 40 degrees. Next slide. Here you see the proposed changes we're asking to make. Proposed deletions are bracketed and new text is underlined. As you can see, we're proposing to delete the current language in 13107C1 which includes outdated information and simply refers to the relevant administrative code section. Why? This will ensure the health code remains accurate if and when the local law changes. Local Law 86 updated Chapter 32 of Title 27, which is the Housing and Maintenance Code. It's generally enforced by the Department of Housing and Preservation, also known as HPD. It's important to note HPD enforces violations in municipal dwellings, while the Health Department enforces in non-residential settings, like commercial establishments. Next, you'll see under 13107E, we're making it clear that the Health Department and HPD can take enforcement action when there are violations. Lastly, under 13119, you will see that we're moving the appeal process from the notification provision, as discussed previously. Next slide. With that said, we're asking the board to vote to approve the publication in the city record proposed amendments to Article 131.
Thank you, sir. Any discussion, any questions on these provisions? Please.
Is there any, will there be in the future any new changes related to the cooling temperature during hot months?
That's a good question. That's certainly something I know the health department has focused on.
Yeah.
I'm not aware of any current plans, but I know the health department is advocating for certain things. Maybe the commissioner wants to.
Yes, as a part of our climate and health strategy, establishing a maximum temperature policy is something that we are exploring. It will require legislative change and other partnership. So, but we're on our way in terms of working towards that. Obviously, extreme heat is the leading climate-related killer in the city. It kills about 350 New Yorkers every single year. All of those are preventable through cooling. We've done incredible work thus far over the last several years to distribute air conditioners to over 70,000 low-income houses, mostly NYCHA users. We've reduced tens of millions of dollars in energy costs through the the Heating Energy Assistance Program, but there's much more to be done. Okay, may I have a motion to approve the proposed resolution to amend Article 131 of the New York City Health Code? And second? All in favor? Aye. Any dissent? Okay, the motion carries unanimously. And with that, that's our last item of business. Our meeting is adjourned.
Thank you.